Hello, good afternoon.
So our scientific work today is going to be about the relevant issues of combined pathology, caries, and gastroesophageal reflux disease. This scientific work was made by the help of our Associate Professor, Tatiana Timukhina, my name, Kareem Nahuoli, student of Group 7609, third year Bogomolcya National Medical University,
And my name is Sam-Nwaomah Jochebed. I'm a student of the 7609 group of Stomatology, third year in Bogomolcya National Medical University.
So, the introduction. Dental diseases in young people have the highest number of appeal of the medical institutions of dental profile. Diseases of the digestive system have same prevalence. It should be noted that seeking medical help for these diseases does not always occur on time. This is due to the reluctance of treatment to the doctor and practice of avoiding treatment generally that begins in adolescence. Survey shows that 63% of young men and 87% of young women take drugs for the treatment of gastrointestinal disorders and pain symptoms in dental diseases without the recommendations of a doctor, focusing solely on commoditizing. Today, it is clearly proven that there is an interconnection between diseases of the digestive tract and pathological processes that occur in the oral cavity. It was found that oral diseases have a direct effect on the condition of the digestive system. It is also proved that receptors located in the mucous membrane motility and secretory activity of the digestive system. Along with this, it was found that pathological reflexes of internal organs have a negative effect on the oral cavity. Caries and its complication take the leading role in the development of gastrointestinal diseases in young people.
Okay, so as you know, in the body of young people, there's always influence of constant microbial invasion and sensitization when diseases of the digestive system are combined with carious. As Kareem has mentioned, caries and its complications, they take the leading role in the development of gastrointestinal diseases in young people. However, quite often, there are various changes which can be determined in the tissues and organs after the oral cavity on the early stages of somatic pathology. Next. So when we researched for this, we found a number of researchers, and these researchers, they found a high prevalence of caries, oral mucosa diseases, periodontal tissues diseases in children and adults with inflammatory and destructive diseases of the stomach and intestine. Different research also shows that caries of the permanent teeth in children with gastrointestinal pathology was detected not only in 21.6% versus 29.4% in children without digestive diseases. Studying the impact of digestive tract pathology on the condition of oral cavity in adult patients, these researchers also pay attention to the intensity of the caries on the condition of the periodontal tissues, the hygienic state of the oral cavity, the indicators of local immunity, and some indicators of saliva. These indicators can be like how high the fluoride or calcium and other minerals are in saliva, which could indicate caries. Many authors also note the intensity of caries in gastritis and peptic ulcer from 5 to 22, which is an increase. Such a high dental lesion in patients with peptic ulcer is explained by the gastroesophageal reflux patients in this group, which contributes to the throwing of gastric juice into the oral cavity and the development of caries and non-carious diseases, in particular erosion of tooth enamel.
So, gastroesophageal reflux disease is one of the most common diseases in the digestive tract. The principal causes of developing pathologies of periodontal tissues lead to gastroesophageal reflux. According to published data, a large number of cases of erosive and ulcerative lesions of the stomach and duodenum are accompanied by GERD. Dysyatnichenko considers a violation of the motility of the digestive tract, which leads to the throwing of gastric contents into the oral cavity as the main factor in the occurrence of disorders in the oral cavity. At the same time, there is much less research works that have studied the local immunity of saliva, which provides the effect of protecting the oral cavity. It was found that patients with PU in 98% have combined immune system deficiency. It is known what is the primary factor of internal organs of digestive with subsequent damage to the oral cavity or vice versa. Here we can see some photos where we can see the effect of acid erosions on the teeth that occurred because of the gastroesophageal reflux disease.
Okay, so in the first clinical study we conducted in our university, Bogomolcya National Medical University, we examined 33 patients in total with dental caries from the age of 18 to 25 years. 21 of them were men and 12 of them were women. This clinical study composed of two groups, the main group and the comparison group. The difference between these groups are in the main group, these patients have a combined pathology of gastroesophageal reflux diseases and dental caries, but the combined group only has dental caries, and they were randomized by age and sex. All these patients who were included in this study, they evaluated the dental status, immunological analysis of blood and saliva flow, gastroesophageal reflux disease assessments by questionnaire. In this clinical study, all the patients who were investigated by these tests and indexes: the enema resistant test, the green vermilion index and Seal-Neslo index, the papillary marginal alveolar index, and the gingival bleeding index.
We also did a second clinical study, where we conducted a questionnaire survey of 33 patients, body mass index of BMI 22.8 to 2.07 kilograms, who complained of heartburn and had endoscopic signs of GERD, non-erosive form confirmed by EDB. Questionnaire survey was carried out by using special questionnaire to identify the clinical symptoms of GERD, risk factors for heartburn, the course of the disease, the nature and prevalence of esophageal manifestations. Immunological screening was carried out on first and second day from the first date of application and after 6 months, and it included 25 major populations and subpopulations of lymphocytes to determine their functional activity of serum immunoglobulins, the concentration of circulating immune complexes of different molecular size, the phagocytic activity of neutrophils, cytokine status. Using the method were defined the following lymphocyte subsets: CD3 plus lymphocytes, CD4 plus lymphocytes, CD8 plus lymphocytes, CD16 plus cells, CD22 plus lymphocytes. The functional activity of T lymphocytes was studied by morphological method by determining the proliferative activity of lymphocytes and lymphocyte blast transformation reaction, LBTR. With mitogen phytohematoagglutinin, PHA, from Burroughs Wellcome. The phagocytic activity of neutrophils was assessed by the degree absorption of latex particles with calculation Hamburg phagocytic index and phagocytic number right. The study of the functional state of B lymphocytes was carried out by determining the level of main classes of serum immunoglobulins, IgG, IgA, IgM, by simple radial immunodiffusion in a gel according to G. Mancini.
Okay, so we have the results of the first clinical study. If you remember, they were carried out with the indicators of caries prevalence, dental caries intensity, and enema resistance. And we have the two groups, the main group and the comparison group. If you notice and see on the table, for the caries prevalence and dental caries intensity, the results are much higher in the main group, who had the combination of both pathologies, than in the comparison group, who just had dental caries. However, if you notice in the enema resistance, in the main group, the result is lower than the comparison group, which shows that the comparison group has higher enema resistance because they don't have gastroesophageal reflux diseases. As seen from the table presented number 1, as I said, the concomitant gastroesophageal reflux disease of prevalence caries was significantly higher than in the healthy individuals, which is a combined group without pathology of digestive system. Indicator of dental caries intensity in the main group was also in 1.7 higher. The result of stability values of hard tissue to the effects of cariogenic factors had a high positive correlation with the intensity of dental caries lesion, which confirms the presence of microconnections of manifestations of somatic pathology, the development of caries, especially against the background of a decrease in caries resistance.
Also, we have the results of the second clinical study, which here we see the indicators characteristic of oral hygiene and periodontal tissue. We also have the main group and the comparison group, and we use indicators as green vermilion index, Seal-Neslo, PMA, and SBI index. An objective dental examination during the initial examination was also established that the main group were significantly higher index of green vermilion and Seal-Neslo in 1.6 as 2.1 times, as we can see here on the table. And PMA index was 21.35 to 1.96%, that indicating the presence of mild gingivitis, and bleeding was 1.53 to 0.03 points.
As you can see from this picture, the woman is overeating and she's eating fatty foods. A study which was conducted shows that the main manifestations of gastroesophageal reflux disease in the examined individuals are overeating and eating of fatty foods. And this causes the appearance of heartburn, which causes significant exertion. Overeating has also led to the emergence of heartburn in 52.9% of the respondents, smoking at 29.4%, alcohol in 23.5%, and coffee in 29.4%. There is also observed sensation, sore throat, hoarseness, dry cough with colds, which can be also shown in this, with people who were examined. The results of this survey, they indicate a high incidence of flatulence among respondents that confirm previous studies of negative impacts of bloating in the onset and progression of gastroesophageal reflux disease. Thus, 12 patients are periodically disturbed distension. From the picture, you can see there's heartburn, which can be caused from overeating and eating foods high in fats and cholesterol.
Here we can see the table of condition of cellular immunity in patients with caries and GERD. We have the main group and the comparison group. The immunological indicators were leukocytes, lymphocytes, CD3, CD4, CD8, the ratio of CD4 over CD8, CD22 lymphocytes, and CD16. As we can see here, the leukocytes, lymphocytes, CD3, and CD4 were higher in the main group than the comparison group. However, the rest was lower. The relative populations of CD3 plus lymphocytes were not significantly different in the groups of patients. The total number of leukocytes and lymphocytes also had no significant differences. The relative number of CD4 plus lymphocytes, helper inducers in the main group and comparison group had no significant differences as well. The relative number of subpopulations of CD8 plus lymphocytes in the main group was significantly lower by 32.12%. Relative to the comparison group, as a result, we revealed an increase in the immunoregulatory index, which indicates an imbalance of immunoregulatory subpopulations associated with the development of autoimmune disorders of GERD. By analyzing the above data, it should be noted that the reason for activation of T and B lymphocytes of peripheral blood is GERD. When it is combined with caries, promotes activation of immune system cells due to the appearance in blood of autoantigens. The high number of activated lymphocytes can also be due to a significant content of pro-inflammatory cytokines TNF-alpha and IL-1 beta, the level of which is elevated in patients with GERD and caries.
Okay, this table shows the functional activity of T lymphocytes and neutrophils in patients with both caries and gastroesophageal reflux diseases. The immunological indicators are this spontaneous LBTR, which means the reaction of blast translocation of lymphocytes, the reaction of blast translocation of lymphocytes with PHA, phagocytic index, and phagocytic number. And you also see the main group and the comparison group and the difference in results. For some of them, the main group has high results, but for some of them, the comparison group has higher results. As studies have shown, the proliferative activity of T lymphocytes in patients with gastroesophageal reflux disease and dental caries was normal, and they had no significant difference between the examined groups. However, there's a presence of gastroesophageal reflux disease in patients with tooth decay, and there's a spontaneous activation of lymphocytes proliferation by 25.8%. This may be a manifestation of how autosensibilization to own tissues, and they indicate the presence of circulating self-antigens, which stimulate cell proliferation and is a feature inherent in subclinical information of the immune GERD.
The results in both surveys were found an increase in phagocytic activity of neutrophils, significantly higher rates of phagocytic and phagocytic index due to a prevalence and intensity of caries process. Despite the presence of B lymphocytosis in patients with GERD and dental caries, concentration of serum IgG, IgA, and IgM in both groups surveyed did not have significant differences. In the body of patients with GERD, caries was found increased content of the medium and small molecular cysts that had the phagocytic properties. Here we can see the condition humoral immunity in patients with GERD coupled with caries. As you see, also we have the immunoglobulins G, A, and M, and this is large, medium, and small. The results of the study, the patients with GERD, when it is combined with caries, observed changes in the immune system, which are features of subclinical immune inflammation. Also, a study was conducted of local immunity of the oral and fluid of persons surveyed. Also, we can see the photo here of how the gastroesophageal reflux can affect the teeth and the wearing of it.
This table shows the condition of local immunity in the oral fluid of patients with gastroesophageal reflux disease coupled with caries. The immunological indicators are immunoglobulin G, immunoglobulin A, cellular immune complexes, which are large, medium, and small, and TNF. Also, we have the main group and the comparison group. The results, as you can see from the data presented, the individuals with caries and pathology of digestive tract due to the constant chemical acid, there's irritation of the oral mucosa that's observed, and it's like really high of a pro-inflammatory cytokines, tumor necrosis factor, increased immunoglobulin G concentration as a result of antigen challenge, and also significantly lower concentration of secretory immunoglobulin A. Reduced concentration of the latter is an apparent and is one of the reasons for the large intensity and prevalence of caries in patients with gastroesophageal reflux disease. Because of the above mentioned disorders, there's revealed cellular immune complexes imbalance in oral liquid of main examined group.
As a conclusion, the study revealed a higher intensity of caries process in patients with GERD. It is connected with a permanent lesion mucous membrane of the oral cavity acid. Furthermore, it was found violation in terms of concentration with increasing local immunity, oral liquid pro-inflammatory factors, and a reduced concentration of secretory immunoglobulin A, namely with concomitant pathologies of gastroesophageal reflux disease, GERD. Thank you for listening.
Thank you for listening.